It's Talkback right here on CNA938 and 0.97. 0.97. Let's remember that number, everybody, because that is now Singapore's total fertility rate. It is an historic low, and it has dropped below 1.0 for the very first time. Some of the reasons, we're going to delve into a lot of these reasons during this show, but we also want you to help us elaborate on them. But some of the reasons that have been cited include couples having their marriage plans disrupted by COVID-19, some financial costs of child raising, and of course, difficulties managing work and family commitments.
Yeah, I think another reason is people are saying, you know what, I can have a kid a little later, but then when they start trying, they can't.
But that reason has been around for a while. But I wonder whether this historic low has anything specifically to do with COVID as well. Like, because this has just come on the heels of 22, 23, have people decided, like, you know what, I'm off to travel the world, or I'm putting off family until things calm down.
True.
And there's no global wars or pandemics.
Yeah, because when you talk about COVID-19 delays, there were delays to maybe getting their flat. There were delays to maybe getting married even. So these sort of add up. So maybe it's a whole string of factors that are sort of involved with our fertility rate dropping to below 1.0 for the very first time.
If you have been through this process of thinking about whether or not to have kids now or later or delay it, we would love to hear from you so we can flesh out this question. We're asking, what's holding more Singaporeans back from having more babies? You can, of course, call us at 669-11938 or WhatsApp at 963-11938. Dr. Tan Eng Loy is joining us for the first part of this discussion. Dr. Tan, of course, an obstetrician and gynecologist out of EK and EL Women's Clinic. Hi, Dr. Tan.
Hi, Daniel and Lance. Thanks for having me.
This fall in the total fertility rate to this historic low. Like Lance mentioned earlier on, that reason where a lot of people in Singapore might be delaying because they're pushing it off. They're building career first. They're waiting for flat first. And then, age plays a part. Medical reasons, could they be something at play here as to why fertility rates are dropping?
I think it's a very complex issue. I think certainly the things that you guys have mentioned, I think is also covered in the news as well. I think the report from the government, I think when they announced the news, right, I think many issues, COVID pandemic, uncertain economic situation, inflation, pressures from society, and I think you mentioned delay in getting the flat, delay in getting married, perception about work-life balance once you have a child, changing of individual priorities and societal norms. I think these are all factors, and obviously it's not cheap to actually raise a child. It takes a whole village to raise a child, literally. But I think to a certain extent, delays in plans for conceiving also lead to a situation where couples are older when they conceive. So invariably, we may be seeing more mothers-to-be with medical issues such as high blood pressure and diabetes, which may make it harder for them to conceive in the first place. And when they do succeed at it, these problems will certainly make their pregnancies more high-risk in nature.
Okay, so when we talk about women giving birth as well, when is a good time for them to actually conceive and have their children? Should it be in their, probably before they turn 30? Is that the ideal time, you'd say?
Well, we know that a woman's natural fertility potential declines rapidly after the age of 35. We would say that the majority of women should be in their prime between in their 20s up to about 35. 35, is when things start to slow down a little bit. So the fact that they are trying to conceive later in life is not helping because this will obviously have an impact on their success rate. Age is also a very important factor for those who seek help in conceiving. And for couples who need fertility treatment, success will be more likely in women who are younger. So waiting too late to start a family may not help this group of women who may already need further assistance to begin with. So the clock is literally ticking.
669-11938. If you have any questions or comments, our question today, what's holding most Singaporeans back from having babies. You can also WhatsApp us at 963-11938. In this segment, we've got an obstetrician and gynecologist joining us, and we're exploring some of the physical or the medical issues that can be at play. We've got sociologists joining us in the next segment. We'll talk about the interplay of some of the other factors as well. We're going to be chatting to one of our listeners very soon. Mr. Heng is standing by. But very quickly, Doc, can I ask you, when you've got couples coming in with fertility issues, correct me if I'm wrong, but we don't want to portray this as a purely female issue. After all, from a medical point of view, isn't it said to be, generally speaking, 1/3 a male issue, 1/3 a female issue, and 1/3 we don't know? We can't find the actual reason.
That's perfectly right. I think the kind of rule of thirds do apply. And, there are obviously some couples that, despite all our investigations, we can't really find a factor as to why they can't conceive, right? So certainly these will need more advice, right, as to whether they may need some assistance getting pregnant. But certainly, I think when it comes to seeing any couple with a fertility issue, it is always important for us to work out all the different aspects to consider the problem from all viewpoints, right? So male, female, right, and if failing which, then obviously they will be classified as unexplained, right? In which case, I think treatments, management plans will have to be discussed certainly.
Okay, so let's talk about maybe different reasons why couples are finding it harder to conceive as well. Would it be, there's a higher level of stress, there's pollution, there's probably more drinking, maybe smoking as well, working long hours. Would you say all these factors come into play as well because it impacts on the quality of maybe even the sperm?
Definitely. I mean, I think maintaining a healthy lifestyle, maintaining a healthy weight, eating a healthy diet, exercising regularly will certainly help. And certainly for those who are smoking, quitting smoking will definitely help. And for those who drink alcohol, quitting or limiting alcohol intake is probably something that they might want to do. I do find that a common observation amongst many couples who come to see me about fertility is that they are not trying frequently enough. All right.
Right.
I have some couples, I think it could be due to work, due to stress, due to lack of time. All right. But when they come to see me and I ask them, how often are you trying? And they tell me, well, maybe once or twice a month. And I think we are so target orientated, so goal orientated that, there are many couples who are actually doing ovulation testing just to find out the best time of the month to actually do it. Right. But, that approach will just increase stress further, and that stress doesn't help them to conceive.
We are going to be picking up your calls in just a moment. Dr. Tan Eng Loy is joining us, obstetrician gynecologist, EK and EL Women's Clinic. I'm curious, at the end of the day, Dr. Tan, anecdotally, have you seen more people coming forward, and maybe from a younger age as well, when it comes to fertility issues in Singapore?
Not that I have really observed. I would say that's quite difficult to tell. I mean, compared to the past where couples were conceiving at an earlier age, we are certainly seeing couples, who are trying to conceive when they are much older. And therefore, some of them do have some chronic medical illnesses that might have developed along the way. Things like diabetes, high blood pressure. We have even seen some women, who have had a past history of stroke or even a heart attack before. So these do make things a little bit more complicated. And certainly when they do become pregnant, they tend to be much more higher risk during the pregnancy itself.
So is there very little that can be done? I worry that, and I've covered this on the health programs as well, I worry that people think that, no problem lah, I can delay because if I need to, always got IVF.
Yeah.
So I think that's a challenge that we basically need to address. I think no easy single way to actually, no single solution to this, but certainly I think we need to stress, that age is an important factor when it comes to successfully conceiving. And I would basically encourage couples who are trying to conceive not to put it off too late. Okay. Careers are important, but
here's the thing: I can understand the whole body and soul of it all, The couple might think like, we haven't got the flat. I haven't been promoted. I'm still very junior.
Yeah, because like what Dr. Tan was saying as well, it's not cheap,
Yes.
Raising a child. There's also a lot of stress involved bringing up a child too.
Pediatrician visits and so on and so forth. Let's go to the phone lines and see what our listeners think as well. 669-11938. On the phone right now, we've got Win, I do believe. Hi, Win. Welcome aboard. Win, can you hear us? Hello, Win on the phone.
Win?
Oh, yes.
Hi.
Hello.
You had a question. You
Good
wanted to
evening.
join. Hi, good evening. Thanks for tuning in.
Yeah, thank you.
You had
Thanks
a
for-
question,
for-
actually, didn't you?
Yes. Just this is what I heard, that if you don't want to conceive the baby, you have it 1 week before the menstruation and 1 week after menstruation, then you won't conceive.
But we're asking the opposite. We want people to conceive, Win.
Sorry?
We're talking about the opposite thing. We need more people to conceive.
Yeah, but then if some they don't want to have, so yeah, or rather when is the best time to have?
Okay, so you're saying when is the best time to conceive, yes?
Yeah.
Okay.
Thanks very much, Win. Okay, could it be a timing issue, Dr. Tan? Are people, if they're trying for to have a child, like you said, they're checking in with apps, they're measuring whether or not ovulation is happening, and looking and monitoring charts as to whether menstruation is occurring. Like what Win said, he'd heard off the record things like you have it 1 week before, 1 week after, maybe you're missing the window. When is the best time? Do doctors speak to their patients about this?
Yeah. So, unfortunately, I think by targeting a certain time of the month where a woman may be more fertile, that actually invariably adds to the stress, right, of trying to conceive. And stress is not a helpful thing. So the general advice that most of us would suggest is that try to relax, right, be chill about it, and try often. And the general statistics suggest that 40% of couples, in fact, 80% or over 80% of couples under the age of 40 in general will conceive within a year if they try 2 to 3 times a week.
Okay.
All right. And for those who do not succeed, right, if you try up to 2 years, right, by then about 90% of couples would have actually succeeded. Right. So the issue is basically not trying often enough. So I think that's one of the difficulties. But it's not that easy, obviously, right? Because obviously couples, we are stressed with work, we are stressed with a lot of other things. There are a lot of other things to be done. And I would say that many of the couples who do see me, unfortunately, they do confess, right, that it's a frequency issue.
Yeah.
What are the biggest mistakes couples are making when it comes to conception? Let's put it that way.
Yeah.
Doc,
Sorry.
what are the biggest mistakes couples are making when it comes to conception? Let's put it that way.
I think delaying till they are much older is probably one of it. And then I think the frequency of trying is one. The other issue sometimes is also seeking help only when they have been trying for too long. Right. There are some couples who are very, very anxious. They try, within a year and they come to see us, but they've also seen some, who've been trying for ages, right, without actually asking for an opinion as to what, might be going wrong.
Yeah. I'm just wondering with the advancement of technology as well, are there some apps that some couples can use to maybe tell them that this is a great time for you to maybe go ahead and try for baby?
That'll be a good feature to come on Apple Watch soon, man.
Yeah, can that actually help couples with
help.
apps, that they can rely on to say
But you
this
see
is
that-
the best time? I'm just wondering whether we can give them a helping hand.
I've spoken to couples who've employed methods like that, and
Yeah.
they've also said what happens is, unfortunately, it programmatizes the experience, and
Yes.
Oh.
it becomes a problem as well.
Okay.
If you feel that there's a timetable or there's a structure that takes away from the opportunity.
But if you think about it as well, there's going to be an end result. It could be a positive result. Sometimes you have to be looking at it in a more
Scientifically?
functional manner.
yeah, Doc,
Yeah.
what do you think? I mean, you've heard both sides of the story,
Yeah.
right?
Yes. I think in the current society where everyone is so busy, the apps do help to a certain extent in at least letting the couple know when, they are fertile. All right. But as I said, using all these apps do sometimes add to the stress. For some of the couples that I see, in fact, I tell them, basically try and relax, right? If possible, go for a holiday and try during that holiday.
I tell you,
Actually, that
I think
always
that's
happens.
a great idea. You know why? Because sometimes they're staying with their in-laws or with their parents, and
Contrary
you
to
can't
what's been
sneak.
said before, space is important.
Yeah, you can't sneak into the bedroom.
Yeah.
It's like
No, but it's also
people might know what's going on.
But it's also the holiday mood when you
when you're
stop
away.
thinking about it. Apparently,
Correct,
that's when
yeah.
fertility experts say it can happen, right,
Yeah,
Dr. Tan?
and because you're moving away from that stress zone.
Yeah, holiday expensive now. No? Go Japan exchange rate. We heard
Go
just
across
now earlier.
to Johor.
Johor, maybe. Dr. Tan, we had a question at 9631193 at our WhatsApp. This person says, you all talked about the figures and how this is happening after COVID. Did COVID affect fertility? Okay, I'm sure some people are thinking that as well. And maybe some people, like the anti-vaxxers, might think that as well. Is there any medical evidence that COVID in any way impacts fertility?
I don't have any research data to back what I'm going to say, but anecdotally, although we think that COVID, might have basically dampened some of the enthusiasm at starting a family, but ironically, I think during the COVID years, especially at the start of the pandemic with the lockdown and all that, I did have a few couples come back to me. I mean, they were not first-time parents, right? But they have had a baby before, but simply because of the time they have had more time to spend at home, right? So they came back with a second pregnancy, with a third pregnancy. So they were sort of increase among some of the couples I've seen, right? But certainly, I think the overall statistics do not support that. The fertility rate has actually gone up during the pandemic period.
But functionally speaking, medically speaking, no evidence per se that the COVID, if you got COVID, somehow affects your fertility, anything like that.
Not that we are aware of. Yeah. I mean, for some women who have just been infected by COVID, they may see a delay in their menstrual cycle for maybe a couple of cycles, but things go back to normal usually after that. And I don't think the COVID infection would have actually had. So far as I'm aware, I don't think it has basically caused a decrease in fertility overall.
Dr. Tan, this has been very useful. Thank you so much for helping us deal with this first facet of our talkback question today. Dr. Tan Eng Loy there, obstetrician and gynecologist from EK and EL Women's Clinic. Our question, what's holding more Singaporeans back from having more babies? It's more of the social issues coming up next. Stay tuned.
Sculpted by tomorrow. Inspired